see. However, congratulations on the acknowledgement of the award you received this morning, and you make us all very proud. Vaccine equity in Maryland is a hot topic. It's a topic that is being brought to our attention from the governor's office, from the Maryland Department of Health, and from the National Guard. The statistics I heard are similar to the ones you recited. 13% of all Maryland inhabitants are Hispanic. Of all the vaccines given as of last week, only 3.6% were given to Hispanics. I don't know what the specific numbers are in Frederick County. For African Americans, 36% of all Marylanders are African Americans, but only 25% of the vaccines distributed have gone to them. There are some limiting factors and some barriers. And I think what amazes me is that the Institute of Medicine, now known as the National Academies of Science and Medicine, came up with this plan. And they couldn't see some of the shortcomings that implementing this plan would have on minority populations. The first one's access to technology. And it's being corrected now, but initially you had to have a computer and access to the internet to be able to register. And in Hispanic populations, that is a very, very low item in their bag of tricks. The same goes for African Americans. The second one's transportation. We at the practice have employed buoy transportation systems through a program called CLIDE, and it doesn't stand for anything. CLIDE is just the name I gave the van we had 10 years ago. I named all vehicles. And we had to stop running CLIDE in November due to some budgetary constraints, but we're starting again in 10 days. The plan is to have patients that are not our patients call, and we will go pick them up at their house and bring them in to get their vaccine. The third issue is the definitions of phase 1A, 1B, and 1C favors people who are recipients of higher education. So right there, you're limiting Hispanics and African Americans, and of course you're going to see this disparity. Also, the age groups are not really fair. Hispanics are younger, a lot younger. I can count on my hand how many Hispanics I have over the age of 80, but I would need the hands and the feet of all the people I employ to count how many Caucasian Americans are over the age of 80 that qualify for these shots. So there's also a disproportionate amount of people in the food industry and in the construction industry that are Hispanics, and they have this fear of getting vaccinated. There are two remaining obstacles, right? And one of them, I don't think we can do anything about it. Many of the African Americans that have resisted to the vaccine relate back to the Tuskegee experiments of 1948. I'm not going to bore you with the details, but there's still fear in the African American community that similar experiments are being taken out on them. We have been able to work with the churches. We have been able to work with the pastors to dispel that. And we have a champion in our office, Mrs. Faye Page, who is, we call her the queen, and she has been instrumental in shedding that. In the Hispanic community, there is a little obstacle, a huge obstacle in Frederick County, and it's called 287G. Oh, no, I'm sorry. I know I'm gonna get in trouble for saying this, but is there any way that for 12 weeks we can pause 287G so we can vaccinate our people? I would like to request, and I'll get on my knees and beg, that at the next council meeting, a motion is brought up to put 287G on hold for 12 weeks so we can get our people vaccinated. That is a real obstacle. Let's call it by its first and last name. These are invisible people that still get infected by COVID and still can spread COVID, and we need to vaccinate them. I'll do it for free. Heck, I'll pay them to get me vaccinated. But please suspend 287G for 12 weeks, just 12 weeks. And after that, we can go back to the good old times. But if you guys could bring that, you'd be doing an enormous favor. When the pandemic began, we didn't close our doors. We realized that there was a need for the Hispanic community to seek medical care. We ran into some issues. First of all, lack of PPE. I was distressed that our health department was not provided with enough of them to help us out. So we used coffee filters for masks. We used trash bags for PPEs and painter's hats from Lowe's for head coverings. FHH, Frederick Health Hospital, came to our rescue. The one thing that was going to make us close our doors, we ran out of toilet paper. And when we're down to our last roll, Tom Kleinhans on his crew started sending us a weekly allocation of toilet paper that allowed us to keep our office open. Luke Markey, if you're listening, thanks for the N95 mask you provided to us. You saved my life and the life of the people that work for me. McClintock Distillery donated 5 gallons of alcohol so we could wash our hands. They're just on the street. Suspiciously, some of it smelled like tequila. But I'm still alive. And if it wasn't for them, I'm not sure I'd be here. One of the things we have to be aware of is that in Montgomery County, pets of Caucasian Americans were being tested for COVID. Well, we couldn't get Hispanics tested in Frederick. And at some point, if something comes out of this, I think somebody's gonna have to take some responsibility and some leadership in making sure this kind of insult doesn't happen again. Because we were told indirectly that people's pets could be tested but not our Hispanic. Yes, correct. In Montgomery County, dogs were being tested for COVID. It was in the news. So once we started testing, we started receiving people from as far away as Richmond, Philadelphia, and Pittsburgh who could not get tested. All these were Hispanics. So a shout out goes also to BioReference, and they made the kits available to us very early. Right now, we are the proud recipients of 3 grants, and I'm sorry for getting on my soapbox. I'm sorry about that. We've received 3 threatening phone calls this morning already. I expect tomorrow's going to be even a little bit worse. But Dr. Brookmeyer very generously gave us 500, actually 1,000 doses of Moderna vaccine to serve 500 patients for phases 1A and 1B. And we've been able to dole them out equitably. We've been able to reach out to people who are at home. We've taken vaccines to their homes. We have interacted with the Asian American Center. We vaccinated the people on their list. We've also been, we're going out to Brunswick, I think this Saturday, right, Michelle? To vaccinate a group home and all their employees who are Hispanic. What I love about what Dr. Brookmeyer has done, she has made sure that we have no restrictions in place to vaccinate undocumented immigrants. And thank you for that. We've also been recipients of the Maryland Department of Health grant through Dr. Howard Haft and Secretary Dennis Schrader. Their restrictions are a little different than yours. We're allowed to vaccinate 1A, 1B, and 1C without restrictions. And so it's confusing. Initially, we were told by them we could only vaccinate people who were registered into practice. Now, that restriction was lifted last week, okay? So it's, as hour per hour, the requirements change. But we've been chosen as one of 15 pilot practices in Maryland who participate in the MDPCP program. The MDPCP program is Maryland's answer to the Affordable Care Act, and it addresses Medicare populations. However, they requested that we not only give vaccines to patients with Medicare, but to any patients that qualify who are not on the Medicare rolls. So we will be getting 100 doses of COVID vaccine from them weekly. It's expected that this pilot is going to be expanded to 567 practices in Maryland, and they will be distributing 100 vaccines per week for 12 weeks. The registration requirements are different. We only require to document for the government age, gender, race, and ethnic origin. Now, in Hispanics, we're not going to ask anybody for the Social Security number. If they want to provide us for a Maryland driver's license, that's enough. There's a program, something called HRSA, where we can get paid, I think $15 per head if we provide a Maryland driver's license. But that's another restriction in Hispanics. They don't want to be identified. Interestingly, we have an office in Baltimore. Just opened it 4 months ago on the grounds of St. Agnes Hospital. So out of the vaccines we're going to be getting, 150 will be designated to go to Baltimore. And we've been asked to consider opening another site in Baltimore, but I don't have the funds for that. What we're going to do with these is basically anybody who calls in and qualifies will give you a shot. Just call the numbers 240-215-1138. What is the other number, Michelle? Oh, okay. And ask for Susanna or Faye, and the registration is simple. You don't have to do anything on the keyboard. We'll do it for you, and we'll provide the government with the vaccinations and all that. The third grant is from the governor's office through the Maryland National Guard for their Vaccine Equity Task Force. They have no restrictions. So this is even more confusing. They're going to be providing us with 500 vaccines per week, plus another 100 for Baltimore. Okay. Brigadier General Janine Burkhead is who's leading this effort, and if you read her CV, she's very impressive. We've been interacting with Colonel Eric Allely, who's a physician and who's a Maryland state surgeon. And basically they want us to concentrate on vaccinating minorities, not only in the office, but in the community and at home. So it's kind of a reinforcement of what we said before. There's a couple of other issues. Western Maryland, west from here, there's really some, and this is not a concern, but there's a lot of resistance to this program. But I encourage anybody who's got a family member that they want vaccinated, the registration is minimal. My performance in giving vaccinations is going to be related to how much I can afford in overtime costs. And Ralph was there, and he's the kind of, Ralph Klein is in charge of our finances, and I hear from him daily. So we've been able to budget that we should be able to give 600 vaccines a week without increasing our costs too much. And that's all I have to say. I thank you for assisting us.
Can you share how many vaccines you've given out so far?
We started vaccinating last Tuesday, and today we have given 346 vaccines. 280 are yours. The other are from the MDPCP pilot program.
Okay, very Dr. Menocal. We appreciate all you do every day for the community and what you're doing to help vaccinate people. And we appreciate your partnership with the Health Department and with the Maryland Department of Health and with the Equity Task Force, because there is certainly interest among all of us to make sure that we get everyone in our community vaccinated. And it's really important for public health, and it's really important to address health disparities. It's really important for the basic functions of fairness in our community. I will say, in response to a couple of your comments, the rules and regulations have been different for us versus the hospital, versus the pharmacies, versus the mass vaccination site. They've all had different registration systems, and we agree with that confusion. And certainly today the governor is going to have a press briefing at 2. He may announce some new changes to rules. So we just go with the flow and do our best to communicate what all those changing dynamics are. We struggled like you did with PPE and hand sanitizer. We have a clinic distilled hand sanitizer in the building right now. I think it smells like rum, not tequila, but that's, I guess, a matter of opinion. And we had issues with testing as well, but certainly, and that was a real concern last year. I will tell you, I was very emotionally upset about the lack of PPE for our healthcare providers last year. We have solved that problem. We do have inventory of PPE, and it is for community need, for the hospital, for everybody else who needs it. And we have tried to spread that around the community, so that has not been a problem, at least that I know of, in many months.
It's been resolved.
And the same with testing. There's certainly plenty of testing capacity in the community now, but again, that was a problem for everyone last spring, and they couldn't get the components for that. So I just do want to point out to everybody who's listening that those issues were very real for all of us last year, and they have all been solved. Now, our biggest issue that we're facing now is trying to meet the demand for vaccine. And, we hope it stays that way, and that we can get everybody to